Hello everyone, my name is Devinder. I am presenting here a video regarding peritoneal catheter care. Objectives. By the end of this video, the learner will be able to discuss peritoneal dialysis type of catheters, be able to discuss about swan neck PD catheter, its rationale and advantages, demonstrate pre-operative and post-operative care of patient, demonstrate exit site long-term catheter care of patient, and have a knowledge about body image concern and fears of PD patient. Peritoneal dialysis catheter. It's a type of access for peritoneal dialysis that is surgically placed in your lower abdomen, provides reliable and rapid inflow and outflow or from the peritoneal cavity without leaks or infection. Types of peritoneal dialysis catheter. Tankoff catheter, straight or curled, swan neck catheter, Toronto Western catheter. Today I will discuss about swan neck catheter. It's a preformed permanent, has a bend of 150 degree to 180 degree. Permanent bend allows for the insertion in downward manner in both the rectus muscle and the exit site. It is made of silicone. The cuffs are made of polyester to allow tissue ingrowth and prevents leaks and migration of bacteria. Here I showed the positioning of the catheter, the middle cuff, the subcutaneous cuff, and the exit site where the outside tube is lying. So swan neck catheter, the rationale for use. It is with the two downward pointing segments. Downward insertion is thought to prevent migration of the catheter outside of the pelvis. Migration of this type is rare, thereby serving to aid outflow. The associated advantages. It's thought to prevent infection at exit site as this segment of catheter also point downwards, thus preventing accumulation of sweat and pus. So the pre-insertion preparation of the patient. First of all, have a full pre-operative assessment, assess patient's lifestyle, work and hobbies, assess the catheter exit site. The following points should be followed when determining the exit site of the patient. The site should be determined while the patient is in a relaxed sitting or standing position. Should be either above or below the belt line, whichever the patient prefers. Skin folds and abdominal scars should be avoided. Exit site should be located where the patient can effectively carry out exit site care. Once the exit site has been determined, it should be marked clearly with a permanent skin marker. So in these pictures I tried to show marking the exit site and insertion and where to give the incision and exit and entry point, and about the cuffs where they are lying, peritoneal cuff and subcutaneous cuff. So the patient should bath or have a shower on the morning of operation. Empty bladder before the insertion procedure takes place. Bowel preparation, as a distended bowel can interfere with the placement and function of the catheter. As a Foley catheter for patients with neurogenic bladder. Assessment of abdominal wall for hernias. Consider for repair at the time of insertion. Staphylococcus aureus screening to avoid increased risk of exit site infection and peritonitis. Prophylactic antibiotics and psychological preparation of patient. Post-operative care of patient. Goals: to minimize intra-abdominal pressure to prevent leakage, to minimize any bacterial colonization of the exit site and tunnel during the early healing period, to prevent trauma to the exit site and traction by immobilization of the catheter. The following measures need to be followed. Immobilize the catheter all the time. Keep the exit site undisturbed for 7 to 10 days following insertion of catheter. Flush the catheter with 500 to 1500 ml of PD fluid to check for patency. Instructions for caring for catheter at home. Change dressing weekly for first 2 to 3 weeks. Strictly use septic technique during dressing change. Use non-exclusive dressing for draining and drying. Avoid activities that increase intra-abdominal pressure such as constipation, coughing, straining with stool, bending. So for the long-term catheter care, the main goal is to prevent exit site infection. Knowing how to assess sign and symptom of infection. Proper exit site care will reduce the risk of infection. Proper hand washing should be done before doing exit site care. Use non-cytotoxic antibacterial soap or an antiseptic solution to clean the site. Avoid harsh solutions. Cleanse in a clockwise motion. Discuss swimming and bathing options with correct recommendations. Keep this exit site well covered. So here, first look for the exit site for any signs of infection, for any redness, warmth, or swollen area. Then the cleaning technique in the clockwise direction. Application of antibiotic cream and how to secure the catheter. So the patient with the PD catheter has mainly body image concerns, as this is a very life-changing thing. So the body image concerns are protruding line from abdomen. It limits clothing choice and alters appearance. Concerns about partner's response or not finding one. Feeling embarrassed and unattractive. Feeling of withdrawn and depressed. So solutions in order to encounter the body image concern. The patient with the PD catheter are still what they are. A catheter does not change who they are. And a catheter may not look as bad as they have fear because the outside tube is very small. And a catheter does not show under the clothes. People don't know if they have one unless they want them to know. And also they can tuck the tube into a soft fabric PD belt so it does not catch on clothes. Also, they can use a special PD belt to keep catheter safe and out of way during intimacy. And here are some references. And thank you for your time to watch this video. Have a good day.